Hello, Jessica, and all of our friends in Green Bay, Wisconsin. My name is Philip Rulo with Rolltract, and I wanted to quickly go over a couple different options that we have for rakes for the thymectomy procedure. You can see here that we have one of the rakes that you and I discussed into the incision. Seems to be lifting pretty well, although this is not a 220-pound person. But this certainly will lift the manubrium on a large patient. So that is one of our options. I'm not going to go through all of the options. I will send you all of the options. I just wanted to show you the difference here. So this is a standard, what would be referred to as a xiphoid rake, because it was designed to lift the xiphoid, but it is often used to lift the manubrium as well. Now what I did a couple of years back, I designed a rake, or two actually, for a surgeon at Yale University for a thymectomy procedure. And this rake is bent with a geometry that's designed to move it out of the way so the surgeon's able to move the scope from side to side. Now, whether or not the surgeon's going to use the scope here, I'm not sure, but the rake actually works very well either way. So you can go ahead and put that into the incision and elevate, and the geometry here will allow the surgeon to move the scope from side to side without hitting the rake. So we have two different versions of this. We have a very short reach, and then the one that I just put into the incision is a little bit longer. And they do have a very similar geometry to an Army-Navy blade. So I do believe that this would be something the surgeon would be interested in at least looking at. And again, we have the 72 with the two prongs. And that's designed, obviously, to allow a better purchase under the manubrium so it doesn't slide out. This rake here that you and I had talked about has very sharp tips, but it is designed also so it won't slip out. A couple of other rakes that aren't on the website. This is something that was designed for sternal elevation, but it has serrations cut in it, so it will allow for, again, a very good purchase underneath the manubrium, and it won't slip out, and it does have a little bit of a geometry bend to it to allow for movement of the scope as well. So those are a couple of different options. I will send them all to you. You guys can take a look at them and decide what you think is going to work best. But something else that I want to point out also is you will have to have a Rolltract extender bar in your tray. Now, your hospital has extender bars in all of the trays as far as I could tell, but you're going to want to be sure that for this case on Tuesday, this piece is in the room also. Now again, from what my records show, all of your cardiac trays have this piece, but you'll want to be sure that it's there on Tuesday, because if it isn't, you're not going to be able to reach a midline incision. I hope that information helped. I will email you tomorrow. Have a safe drive home.